great pleasure to welcome Mauricio Barahona from one of our sister centres, the Centre for Precision Medicine and Precision Healthcare in Imperial. And Mauricio's going to tell us all about their centre.
Not all about it. Okay, thank you very much, John and Carola, for the invitation. This was a very difficult thing, so I didn't even change the title. Because first of all, I didn't, you can imagine, so the audience is mixed. Last talk of the day, who will remain sitting around? So what I did is I took the safe bet, which is I prepared a too long talk, and I will accelerate through the part that I feel, when people are sort of like dropping levels. I thought I had two tasks to convey today. One was to give you a general sort of view of what we understood to be these centers, and I think the EPSRC probably would not mind hearing from us how we perceived the talk and how we reacted to that, and how we organized ourselves. And we had already a meeting at the EPSRC, the 5 centers, where somehow I saw a lot of commonalities. The second thing I want to convey in the talk is to bring already to the fore the fact that there is a lot of, I think, genuine overlap mathematically between the centers, and this is a great opportunity, I think, basically for the 5 centers to actually to create, if you want, a new brand, if you want, of math with the right profile. Okay, so I will give you some organizational summary of things that we have done and how we see ourselves, what our vision is, and then I will, maybe if I have time, I will give you a sort of like an indication of some of the problems we have begun working on. Okay. This doesn't work. Oh, so it does work, sorry. Right. Okay, so this was a call that was put out by the EPSRC, and now that we have gone through the process, I can sort of tell you what our initial reaction was, at least at Imperial, when Mark came around. So we were very interested and intrigued, and it was a very difficult call to respond to, I have to say this. I think the EPSRC wanted everything from us, or that's how we perceived it. So it was very hard to, I don't know, I think Cambridge did the same thing, which is we didn't try to double guess. We decided that, there were certain things we were interested in doing, and we just went around trying to find the right people to actually pursue those things. What was clear to us is that the EPSRC had decided to, in a way, turn around the sort of like the order, and they wanted the mathematicians to be leading. So rather than, with all due respect, having the medic telling you to pass a line through their points, in this case, they wanted us to work on problems that we thought would be interesting and meaningful, and to engage with the right people who would be listening to us. So this took, of course, quite a lot of effort to put together, but it developed into, I think, a common trend between the 5 centers. Of course, different topics, but in a way, similar approaches. Mark has already introduced the 5 centers that were eventually funded, which covered a wide variety of topics. And thematically, ours, which, as you will see, is the Center in Precision Healthcare, I think has the most overlap with actually Cambridge and with Exeter. I think this is fair to say. There is some overlap also with Liverpool. Somehow Glasgow is much more specialized in a particular area. Okay, so I'm not sure. Is this because the Oh, sorry. Is it just too slow, or I don't know? Right. Okay. So hopefully we'll get solved. Okay. So this is basically the people who were fronting the center at Imperial. Well, we had, of course, we couldn't put all the people who were involved, who were many, and so we had to choose, and we made a very conscious decision of actually representing directly from the people involved what we thought the center should be. So we had basically, 4 mathematicians, 2 computer scientists, and 2 medics, because we had a clear view of where we wanted this to go. Chloe, who is sitting in the audience, was appointed later to be part of basically this group who is at the core of what the center does. But it's important to say that there are already like around 40 people involved across Imperial in different capacities. Some of them co-supervising projects, etc. So it's basically a very wide initiative within Imperial. I don't know exactly why this is going so slowly. Okay, so let me just tell you what our aims were. Okay, so we took the following approach. We wanted to develop and apply novel mathematical tools, and what we wanted to bring together was data-rich healthcare applications, and it's called precision healthcare and not precision medicine, because part of this, what the center does is not only concentrated on the individual but also at the population level. So the I'm sorry about this, I don't know why. Right, so the mathematical tools that are behind this involve basically a series of areas that go from graph theory to stochastic processes. There is an amount of control and dynamical systems, and also, and this is where the overlap comes, there is a fair amount of machine learning, but I would say coming from a different perspective, which has to do more with dimensionality reduction. So it's not as statistical as what is being done here. So the mathematical tools that are behind this involve basically a series of areas that go from graph theory to stochastic processes. There is an amount of control and dynamical systems, and also, and this is where the overlap comes, there is a fair amount of machine learning, but I would say coming from a different perspective, which has to do more with dimensionality reduction. So it's not as statistical as what is being done here, where I think there is a lot of to be gained by interactions, in fact. He shouldn't have left so quickly. Right, okay. So the research pipeline that we thought would work was the following. We started from healthcare data. We would include always mathematical methods, and that was key. It would go through computations and algorithms and into healthcare implementations. So that was something that we wanted to keep, and that was reflected in the involvement of different people in the proposal. As I said, these were the methodologies we wanted to apply, and information for you on the center's website, where we have already some of the projects that are ongoing represented. One part that I should mention is how we dealt with the user engagement strategy, which was key to this call. So in our case, what we did is we involved basically quite a few healthcare partners from the inception of the process. We are lucky at Imperial to have a very large range of different institutions within the umbrella of what Imperial encompasses. There are hospitals, several of them involved. There are different centers. Some of them are more on the level of characterization of cellular biology, and it goes all the way to global health and public health. So at all these levels, people are involved in the different projects. You will see them appearing later. Externally, we had several connections with important sources of both data and problems. Again, at the different levels, all the way from the population to the individual. Some of them are institutional, So for example, there are strong connections with UK Biobank and Dementias UK. There are governmental platforms or Public Health England. And also with companies with whom we have ongoing collaborations. And as you see, these are also different levels of description. I guess it's when I stop. I cannot stop. It is a movie where if the guy stops, dies, right? So that's going to be me. Okay, that was at the level of the healthcare collaborators. We also had computational partners involved from the start. Then we have also several collaborators who basically bring together tools, computational tools that are quite specialized and advanced and are important for several of the projects. So we have the Data Science Institute. There are two MRC centers that are specialized in different levels of modeling, and also a strong group in analysis of medical images in the computing department at Imperial. And externally, we also had some computational collaborators in companies who which work on images and on social media analysis, as well as modeling related to public health. Okay. Right. How did we deal in terms of getting people involved throughout? I think this is something that if you have attended to the launch in Cambridge, and I'm sure you have had already internal workshops, it's something that we have to keep throughout the life of the center. So we basically have tried to establish a series of collaborations that will emerge throughout the life of the centers. So we are doing this through internal workshops that will be centered around particular topics and effectively trying to establish these collaborations at different levels. So these are all things that are internal to Imperial. And in addition, there is a very clear set of problems that will emerge because there will be a call for funding projects throughout the life of the center. So we wanted to keep open the possibility of new activities being developed. So as you will see later, we have started with a few projects, and we will develop new projects that will emerge from a series of workshops with all of these centers in the first 2 years of the life of the center. Okay. Right. In terms of industrial engagement, it's a bit trickier in a sense to, there are some partners already in place. The expectation is to create new connections also. We are going to have a series of activities that will be very much targeted at generating solutions that are coming directly from industry. So there is quite a strong culture at Imperial because of its engineering, strong engineering connections on doing, for example, hackathons and other kind of industrial motivated workshops, with challenges. So these are also going to be done for the healthcare technologies arena. So that's one of the things that will happen. And basically we'll, in fact, the first hackathon will be already with GSK, I think. It's planned for, the end of, beginning of next year. And this basically, there is a hack space at Imperial, which is part of what we propose to use, where effectively people can come together and propose, challenges. There is a possibility of prototyping different, solutions, and there is funding already in place for these kind of things. Okay, so we will have our first event soon, and we postponed it because we wanted to get the right people to come, in fact. And in fact, it's probably it's a bit surprising because it's not about mathematics, really, in principle. We wanted to be challenged by people who have things to tell us that are important. So we'll have these two speakers. One of them is basically somebody who has been very heavily involved in crowdsourcing at the institutional level. So she was actually the first person involved in the Open Government Initiative in the US when Obama took office. And then Paul Matthews has been heavily involved in the use of data in the UK at different levels, specifically for dementia and Alzheimer's. So they were the ones who will be giving us their initiative and their drive. Right, so let's get to now the part that is more research. Okay, So I will summarize briefly what the topics are, and then if I have time, I will give you a brief glimpse of what kind of things we've begun doing. Right, so the first thing is, we wanted to operate in this area, and one way of mathematically describing the kind of topics that we will deal with are basically that. So it's mathematical methods for high-dimensional data sets, where dynamics or continuity of different kinds is present. In a sense, that's the mathematical description of what we wanted to do. And this has two levels, if you want, where it becomes important. At the level of the individual, it's about, progression of disease, patients' pathways. At the level of the population, it's about network dynamics, epidemics, the influence of social dynamics in beliefs. So these things can be formalized within, similar frameworks. In both of them, we introduce the abstraction of using graphs and networks for representing these kind of interactions. In some cases, it's an obvious choice because the networks are there. In other cases, it's actually a construct through which we represent information. And the second part that is always present is dimensionality reduction, trying to extract basically concise representations. So we've heard a lot about sparse representations. So that's something where we should be making contact. It's coming from a different, if you want, history, but I think there is a lot of overlap there, and we are very interested in exploring that. Okay, so I will give you sort of like a few ideas about what the things we've done in this area. And well, now comes this one, where I was saying that actually this process of funding is actually institutionalized by having the projects that will start actually throughout the center. So we don't want to get stuck necessarily in the projects we started with. We want to branch out to things that are relevant for industry and end users. Right, so this is a summary of, in our website, of the core research that already started. And as you see, they represent some of these areas we were talking about. The first one is basically disease progression, but starting with very high-dimensional representations of patient, descriptions of patients. There is another one that is basically about transition paths and patient journeys. And this is related to decision-making actually in healthcare, in collaboration with the CRUK, using data from clinicians. There is another one that is where there is a lot of contact with the Cambridge, which is number 3, which is like integrating imaging and omics data for characterization of disease. And the other parts, the other 3, are more at the level of populations. So there is one that deals with social network analysis. There is another one which is about inference of beliefs, hidden states in social networks and how this influences basically health care policy. And the final thing has to do with epidemics. Okay, so these are basically our initial topics. So give me a glimpse of 2 or 3 of those. So, for example, number 4, which is about developing methods to, if you want, mine social data and social dynamics for healthcare concerns. So there is a series of techniques that we have been looking at developing that deal with effectively the analysis of directed graphs, which is very important for social networks. And the idea is to use social data in connection with topics of importance in public health. We've already done an analysis for how the NHS care data scheme generated a debate online and how this evolved in terms of effectively the NHS. Well, it's not only because of the debate, of course, online, but it was a reflection of what eventually happened, which is that it was actually shelved, partly based on concerns about privacy that emerged very strongly, quite immediately in the online debate. We have already started working on similar applications, finding topics, analysis and text analysis online, coupled with social data analysis on discussions about diabetes and obesity. This is in collaboration with Oxford. Anthropology, they are very interested in this topic because although this is a debate that supposedly is about basically public health, of course there is a lot of commercial interests involved in this debate. And this is something that emerges very easily by following effectively this conversation that we collected over, I think it was almost a year, so we had I don't know how many millions of tweets extracting this kind of topics. You can also classify how the users are influential or not. based in this analysis. So it's the potential to actually have some, at least intuition on how to introduce some kind of influence into the debate. Another thing that has been happening later is about the inference of hidden states in graphs and networks based on social, for social features. There is quite a lot of interest in including socioeconomical factors in the way that we think of basically public health and socioeconomic factors playing a role in that. So recently there has been quite a lot of buzz by some work by Nick Jones on vaccine safety and how this is perceived in different countries around the world. Similarly, Paul Matthews has also been involved in several of these using the UK Biobank. And just to conclude, because I think I'm out of time, another thing that we have been doing is basically, which probably is more mathematically linked, so I have a couple of slides more, but quickly, we'll give you an idea of some things that are related to dimensionality reduction. I thought that this would be the one that makes the most contact with things that are done here. So let me just tell you one of the areas in which we have been working. It is about the description of basically stem cell development from very high dimensional data sets, let's say transcriptomics. So you have basically a cell is defined by a vector that is 20,000 dimensional, and you collect a collection of samples that are supposed to be representing the developmental stages. There is this picture that was drawn in 1957, which basically established the parallelism of this process with rolling a ball from the top of a mountain and getting selected into ridges. That's what development was for Waddington when he drew this picture. And of course this has been updated with all the knowledge that we have now. Our challenge was, can we actually obtain a representation of this process under this assumption that this is believable and there is biological evidence for it, that will capture that picture of a landscape that is embedded in this area, in this surface. And that's basically what we have done. So you start with basically the full data, and you can get representations of this sort. Okay, so this is stem cells. It has to do with differentiation. Similar techniques can be applied more generally to effectively the evolution of samples, if they are collected in time or in response to a particular factor. When there is a measure of continuity and there is the presence of a landscape, these techniques can be applied. I guess I'm out of time, and it's a good time to stop there. I mean, we've done some interesting things with this thing, for example, in looking at reprogramming. Okay, so reprogramming is basically the things that they got the Nobel Prize a couple of years ago. The idea is that you take a differentiated cell and you make it go back to being stem. And the idea is, well, they knew how to do it because they created a cocktail that they put into the cells and it goes back. So what we have done is looked at data that comes from these experiments and asked the question, where, in this landscape are they? And what are the genes that underpin this description? And what you find, not surprisingly, is that, of course, you don't go back. You are charting a different part of the landscape. Okay? You can also identify the genes that are responsible for these kind of transitions that take you in different directions. So these are examples of dimensionality reduction techniques. They come from a different perspective because we impose a graph theoretical description to start with. But I think there is a lot of overlap, potentially, in some of these descriptions. So SBL, for example, is something that we've sort of toyed with in no great depth, and we will be very curious to see how these descriptions are different to the ones you obtain in that way. And that's it.
Do you have questions? How do you see all the different data? I mean, you've got everything from social media to omics data to imaging data. Are you looking at building systems that can cope with?
So so we are not claiming to be the all bells, all whistles kind of thing. We understand the difference between the different data and applications. Well, we know that they are very strong. Luckily, there are experts in each of the projects who have both access to the data, and in fact they have been operating with those data sets for a long time. So basically we have designed the project in such a way where hopefully what we want is to actually, in a sense, ask the question, okay, there is an established methodology that is used either in industry or by end users. These are the principles upon which it is based. Here are some possible alternatives in how to modify some of the steps and to do a proper comparison between basically what is the standard as being used by the end users and introducing new mathematical tools for the analysis. The techniques are all different. The projects are, of course, happening with different people, right? But nevertheless, that's the idea.
For the, you mentioned dimensionality reduction. So we are curious in which particular area are you interested in developing new techniques? Is it statistic techniques or neural network or disciplined optimization techniques?
I would say it's closer to the optimization. I mean, of course, you can think of all those things as an optimization, right? It's a matter of how you pose it, right? So the statistical techniques are also an optimization, right? It's just a matter you have to declare your cost function. And I think that's actually a very fruitful area. I mean, when John was explaining this morning, right? It goes all the way. Some of the formulations are clearly optimization based, right? And then there is a more statistical interpretation. Ours comes from an optimization that has heuristics that are graph theoretical. I'm talking about this particular project that you are seeing there. So, I mean, the same as Lasso is a heuristic, right? Because it's a way of penalizing particular, trying to attain something that is not really computable, right? By penalizing the cost function in a particular way. In our case, we actually follow constructions that are graph theoretical from the start. So we are not, if you want, sparsifying a full, if you want, distance matrix or similarity matrix. We start with a construction that by default will always be graph theoretical. Why? Okay, that's a choice. Partly because we want to effectively use methodologies that are based on graphs also to do the partitioning of graphs, because it provides clearer cut clustering and coarsening of data sets. So it's an alternative to be compared, and that's one of the challenges, I would say.
Thank you very much.
Any other questions? If not, there's wine outside. There's feedback forms that we would love to get from you on the registration desk. But first of all, let's thank Mauricio and all the speakers.